consultant working out of our Portland metro area. Nate holds a Bachelor of Science degree in biology and a Master of Science degree in environmental and industrial hygiene. Nate has worked for Oregon OSHA for 23 years, serving as a compliance officer for 8 years, and he's been a senior industrial hygiene and ergonomic consultant for the last 15 years. Nate is one of Oregon OSHA's subject matter experts in dealing with the 2019 novel coronavirus, now referred to as COVID-19. Our other speaker, who is going to be kind of behind the scenes, is Matt Kaiser with our technical section up in Salem. Matt is an industrial hygienist and a technical specialist who joined Oregon OSHA in 2016. Matt holds an honors BS degree in microbiology and an MS graduate degree in molecular toxicology from Oregon State University. Before moving into the technical position in 2019, Matt was an Oregon OSHA compliance officer in our Portland field office, and he, like Nate, is one of Oregon OSHA's subject matter experts in this coronavirus disease from 2019. With that, I'd like to turn this over to Mr. Nathan Sweet.
Okay, thank you, Mark. Honestly, though, if anyone has questions, send them all to Mark. Okay, thank you for joining us this morning. And as Mark said, we're just going to share about what Oregon OSHA has been doing over the past 6 or 7 weeks specifically, and talk about what we're doing ongoing as the dynamics shift here in Oregon. So again, if there's questions that come up during the conversation or the discussion, please write them into the chat box, and Michael Hill will be moderating that. So as most already know, Oregon OSHA's mission, word for word, is advance and improve workplace safety and health for all workers in Oregon. And historically, the agency has been addressing disease. For example, in the bloodborne pathogens standard, there's specific mention of hepatitis B, hepatitis C, acquired immune deficiency syndrome from HIV, tuberculosis. So it's kind of fitting that the agency can use some of those same approaches for this novel virus that is causing COVID-19. Probably most of you have seen that image of a coronavirus, a section of the virus under the microscope. There's where the term corona comes from. So the next 2 slides are basically some explanation about this novel coronavirus that we're dealing with. A couple of things that really caught my attention was, first of all, this is only the 7th known human coronavirus that causes COVID-19. I think most people knew that several coronaviruses cause the common cold. In regards to how COVID is transmitted, there's primarily 2 routes that I've been seeing in the literature from what OHA and the CDC has been posting. The first one is person to person, primarily through the air. And the second one being from contact. So I think now is a good time for us to think about the relationship between public health and productivity. I know across the world, there has been this push and pull with public health and keeping our economy going and restarting our economy and being productive as people. And if we step back and look at it, I think it's easy to see really how public health and being productive are partners that are working together. They're supporting each other. So I think if we keep that concept in our mind going forward, that'll help us be successful with what we're trying to accomplish here. Back on May the 1st, there was an article about workplace safety rules missing in the pandemic. There was a quote from Deborah Berkowitz, Director Worker Safety Program with the National Employment Law Project. I think said it very distinctly. In this situation, protecting workers is more than just protecting an individual worker. It's protecting the public. Now, when she used the term worker, easily that could just be used as employee. Management employees, frontline employees. So early March was when things really started to happen in Oregon. Here's just a few of the executive orders that Governor Brown issued. For instance, St. Patrick's Day, that's when the prohibiting dine-in restaurants had to stop their business in that realm. March 19th, that's when the order was given to conserve personal protective equipment, prohibition on elective and non-urgent procedures. And then on March the 23rd, stay home, save lives. Certain businesses were closed. Those were the ones that specifically would be very difficult to keep operating as normal because of the close contact of the public as well as employees. So that order also addressed developing policies for social distancing, having someone as an officer or a competent person for social distancing policy. And then there were also workspace restrictions, among others listed in that executive order. So now let's talk a little bit about some of the specific ways that Oregon OSHA has been involved in the response. We have at least one person, and maybe more, Mark or Matt, if you know, feel free to chime in. But I know that Chris Otteson, enforcement manager, sits in and is connected with the Oregon Emergency Management System and the task force. So first, we started hearing about this idea of flattening the curve. Here's an image that I thought captured that pretty well. As you can see, the horizontal line, that's where our healthcare system capacity is. And we want the cases of this disease below that line so that we can manage it. We want to prevent the spread and therefore the illness from going above our capacity. Okay, I'm going to try this. It's a nice little demonstration.
Cross our fingers.
Hopefully everybody can see that. So it describes healthcare capacity increasing as something positive.
Hey, Nathan.
Okay. Yes.
It's not showing up. If you could go back to your slide that has the link, we could paste it into the chat box and people could click on it there.
Okay, great idea. I'm going to copy that. And then let's see if I can open the chat. Well, I think Matt probably can paste that link into the chat box. It basically shows an animated curve that we just viewed from the slide before. So back about the time that Executive Order 20-12, Stay Home, Save Lives, was announced, I think it was a local television network mentioned Oregon OSHA. Oregon OSHA has telephones, give them a call. So in approximately 12 days, Oregon OSHA received more than their annual average number of calls across all industries. So as you can expect, that was a busy time for us. Many coworkers were doing things that they hadn't done before. People were coming into their offices on the weekend so they could help address this workload and provide the best service possible for Oregon and Oregon employers as well as employees. So basically, what was happening was employees were calling in complaints about various aspects of the social distancing and the closing of certain businesses. We also received calls from the public on those issues. There were several that I became aware of. One company receiving multiple complaints about some of their work practices. So Oregon OSHA would take these complaints and then they would reach out to the employer and let the employer know what was being called in and then ask them what they were doing to mitigate the transmission of the disease, and then ask if they needed any abatement assistance as they're developing their mitigation plans. So that's one of the things that that Oregon OSHA did, as well as field complaints and reach out to the employers. They also offered abatement assistance to those employers that asked for it. I personally remember hearing from construction companies, groceries, attorneys' offices, a cannabis retail facility. So businesses across the spectrum were really reaching out and asking, hey, how can we do things safely and continue operating? So to continue with the response by Oregon OSHA, just last week there was temporary rulemaking that was completed, and this was in agriculture, and it is posted on the Oregon OSHA website at this time. It's temporary administrative role addressing the COVID-19 public health emergency in labor, housing, and agricultural employment. Additional work that people within the agency are performing include the dental industry. As most of you probably know, this past Friday, May 1st, dental offices and medical offices were allowed to restart elective and non-urgent procedures that required PPE. So there were lots of questions, especially from dental offices, because they had not been open like so many medical offices were. So the agency has been coordinating with Oregon Board of Dentistry, Oregon Dental Association, the Oregon Dental Hygiene Association to try to communicate OHA requirements as well as Oregon OSHA requirements and recommendations in the simplest, most accessible form possible. There's a fact sheet that's being developed, and there were at least 12 different resources for this one fact sheet. So the information is out there, but it can be daunting tracking it down and finding what applies to each location and each industry. Jennifer Ekdahl from the Salem field office is working with the Willamette Valley Wineries Association task force. They're developing a document guidelines for wine tasting room operations. So feel free to reach out to Jennifer if there's questions from the wine industry. Also, while Oregon OSHA was not able to be a part of the work group that was drafting the restarting framework, the agency was able to provide input on occupational safety and health measures as that framework was being developed. And a few that I remember specifically seeing come through, one for restaurants, bars, and brew pubs, outdoor recreation activities, as well as several other sectors. I think retail was another sector that the agency was able to provide input on for their restarting framework. Additional ongoing services. Again, we continue to have someone plugged into the Oregon Emergency Management and that task force. The agency is providing, it's a source of information for Oregon employers as well as employees. For instance, I think it was last week, we were passed a copy of the executive order from the president about meat and poultry production, so we're able to disseminate that to our stakeholders. We're working diligently to make sure that work practices are aligned with the restarting framework. Also, the agency is entering into enforcement activities of safe work practices. I think it was April 13th when that press announcement was released about Oregon OSHA ramping up spot check inspections. And that was to check on employers who were saying that they were implementing these particular mitigation strategies, as well as typical and routine occupational safety and health protections. Some of the other services, so consultative services is still happening. We've been doing a lot of work over the telephone. We've been reviewing people's mitigation policies and providing feedback on those policies, helping employers and employees find information that would be useful to their particular activities. And from what I understand, there's discussion in our consultation manager's office at the moment for phasing in consultative services as we're able to open up again. And it sounds like it might be starting possibly outdoor consultations, perhaps on site, and then the next phases could be moving indoors and eventually going to full service like we provided in the past. Of course, all of this is according to what Governor Brown and their task force allows. So consultative services is still available. Hopefully everyone is reaching out to them and finding good service. So we mentioned spot check inspections are occurring. Consultative services are occurring. Some other areas that the agency has provided information about were best practices and interim requirements, specifically for utilities. Most recently, there was an issue of what would be considered the greater hazard in relation to infectious disease and things like electrical situations, explosions potentially, and what would be the appropriate procedure in that instance. And then recycling, there was another situation where employees were typically working in close contact. So we were able to provide some resource and ideas about how to possibly mitigate transmission in that sector, certainly critical infrastructure. We've already talked about dental clinics. Okay, let's move the discussion to reopening. And again, I like this picture. In my mind, that's an image of public health working together with productivity and how much they rely on each other. So as a reminder, Oregon OSHA does not approve any businesses for reopening. That's all from the governor, and we will be waiting for the governor's task force to announce what sectors are allowed to reopen. What Oregon OSHA can do is they can review perhaps a mitigation plan. And we can provide feedback on maybe gaps that need to be filled or other best practices that we're familiar with that might help out in a certain situation. But the governor's office and her task force, they are the ones that will announce when sectors are allowed to reopen. So this is kind of a hack job that I've done. Just saw this information last night. It's from New York Times. Daily case rate. The top is the daily case rate for the New York metro area. And it looks like the last date was May the 3rd. So you can see where that case rate has peaked and it's starting to decline. Now, if we separate the rest of the United States from the New York metro area, that's the second graph. And that's still going up. So more cases daily. And then this was a hack job that I attempted to add in the graph for Oregon. So compared to nationwide, it looks like we are slightly flatter. I just thought that was an interesting comparison. So to me, these graphs say we need to continue to be diligent in slowing the spread of the disease. So here's another animation of that graph flattening the curve, and hopefully Matt has been able to paste that into the chat box. It basically shows what could happen after reopening activities if we're not careful of mitigating this disease spread. It's a nice little animation. So I like this slide for the third bullet, guidance on resumption of non-emergent and elective procedures. So this was from the Oregon Health Authority's website. It was made available for media. These are the guidelines that I'm aware of. At this moment, I haven't checked today, but there's guidance for hospitals, ambulatory surgical centers, medical and dental offices, other healthcare settings, and veterinary facilities. Those are the only ones that I'm aware of that have been provided guidance on resuming non-emergent and elective procedures by governor. And here is a screenshot of that Oregon Health Authority web page. And I basically copied information from the media resources and key documents area here and pasted those into that slide. Something to remember is we have to keep checking the guidance regularly because it changes so quickly. I was involved in a meeting last Friday about the dental offices and PPE, and as we were speaking, I think there had been additional guidance that we could have used posted on OHA's website that very day. So the point is here, just be diligent, keep checking for guidance to make sure we're all current on these things. So here are some resources that I trust and I go to often. Oregon Health Authority, it apparently will be posting lots of information about reopening Oregon. Of course, the CDC's is a good location for resources. Oregon OSHA has a COVID-19 webpage. Federal OSHA has a COVID-19 webpage, of course. And something I'd like to stress that I've been trying to let people know as much as I can is the importance of our local public health departments. The health departments at the county level are crucial because they are tracking the community spread of various infectious diseases and especially COVID-19. So they are going to have close eye on what's happening locally. And that's very important because, as we know, what's happening in Oregon is different than what's happening in New York. So developing good relationships with the county public health departments, I think, would prove valuable. Additional resources include industry associations and trade groups. And I think the next slide is an example of that. I heard yesterday come down from the task force that as dentists and dental offices are preparing to reopen, they are required to have a certain inventory of PPE for these elective and non-urgent procedures. And my understanding is they should go to the Oregon Dental Association for guidance on finding PPE, which also includes guidance on how those offices that donated PPE can basically be reimbursed that PPE. So work through the association. They can be a tremendous help. And at the moment, if you know a dentist or a dental hygienist, let them know. The Oregon Dental Association has an important role in making sure their members have PPE to restart those elective procedures. Also, tomorrow in Eugene is when the Battelle Critical Care Decontamination System is expected to go live. And that is for decontaminating the N95 respirators for the removal of the coronavirus we're dealing with at the moment. And they have set up a website that provides information on the system. There's links on the website for being able to use the system. And the last I heard several days ago, this decontamination system was going to be on the U of O campus, close to the Matthew Knight Arena, I believe. If anybody knows whether that's wrong or right, please feel free to post a message.
Nate, if anybody wants, send me an email. I got an email this morning from Curtis Reese from the INL.gov about that, the Battelle stuff, and I can send them information if you're interested in it.
That's great. Thank you, Mark. So Mark showed me the Redwood Safety Association webpage, and I thought this was fantastic. There's helpful links in these rectangles. That's excellent. Quick way to access reliable information. So that's what I had for the presentation. I wanted to make certain there was time for questions and discussion. If anybody has something to share, please, I'd love to hear it as well. So I'm just going to open the floor now for questions.
I would suggest to everybody that if you go into the Redwood Safety Association webpage and click on those links, there's a lot of really good information there, like Nate said. And the thanks go to Michael Hill. He's the guy who put that stuff together for us. And Mike, thanks a lot, buddy.
My pleasure. I'd also point out that I've already added today's slides from today's presentation on the website below the meeting information at the bottom. You'll see it today, or in the chat box today. The only other question I had was about the PowerPoints. And so if anybody has any other questions, you may be able to unmute yourself and ask the question, or put it in the chat box and we'll relay that.
So I forgot to mention, this link is for asking Oregon OSHA technical section questions. Matt has been addressing lots of questions the past couple of months. There's also, I think, 3 or 4 more people in technical that are working.
Well, I'd like to close the meeting out then. First of all, thank you very much. I counted 29 folks attending our meeting today. I have names for pretty much everybody except I have a call-in user 3, a call-in user 5, and a call-in user 6 that we don't know who you are. If you could send me an email, I will send you some flyers. Also, I'm going to send that handout material to Mike, and it will be posted on the Sharp Alliance web, or the Redwood Safety Association webpage, along with this presentation. Thank you for everybody attending. Our next Redwood Safety Association meeting will be June 4th. The speaker is going to be Paul Utterback, and we will be doing a virtual presentation. Paul's going to be covering the GHS, hazard communications, SDSs, and proper labeling standards. So hopefully we can see most of you again virtually next month. And Nathan, thank you very much for your time, your presentation. Much appreciated. Matt, thank you for your assistance.
My pleasure, Mark. It was nice meeting with you.
Do we have any questions coming up on the chat box? I know we've got a lot of stuff on there that I didn't even know was there.
Yeah, there is a question here. If an employee wears an N95 mask, do we have them review and sign an Appendix D?
Hey, Matt, why don't you answer that question?
Let me see if I can unmute Matt.
Matt, you might be muted still.
Hi there. Can you guys hear me?
Yeah.
There we go.
All right. Sorry, I was double muted both on my phone and computer. So in regards to voluntary mask users, the rule simply requires that employers provide a copy of Appendix D. There is no additional requirement that the employer document in writing or have the employee sign off on it. So the provision of Appendix D can be done in a variety of ways. It could be simply printed and posted in the employee break room. It could be disseminated via email. Oregon OSHA would provide employers with a lot of flexibility in how they provide their workers who are using voluntary respiratory protection with Appendix D.
I just posted a link to the Battelle decontamination system at the bottom. If anybody wants to copy that and save it, go in later. There's a lot of good information. The Battelle Energy Alliance has done some really cool stuff. They're able to decontaminate 80,000 masks at one time. And like Nate said, this thing is going around and helping a lot of the medical community.
Another question came in. Does the Appendix D apply to non-filtering cloth face coverings?
I'm happy to jump in there on that one again. So Appendix D is not required to be shared with employees who are voluntarily using cloth face coverings. So what we would call in OSHA world, those aren't looked at as respirators or PPE in the traditional sense. So again, for the cloth face coverings, the homemade masks that are not specifically designed and created to be respiratory protection, you do not need to provide Appendix D. However, if you want to, and it suits the employer's training purposes or facilitates internal policy development for their own workplace, there's no reason why Appendix D couldn't be shared. But as far as a requirement from Oregon OSHA for compliance reasons, you're not required, again, to provide Appendix D for employees who are voluntarily using cloth face coverings.
Okay.
So Matt, I got a question if you don't mind. What if the employer is requiring employees to wear something over their nose and their mouth?
So are you still referring to the cloth face piece, or are you talking about an actual respirator, NIOSH certified or some other country certified?
No, to the cloth face covering. So if an employer requires an employee to wear a cloth face covering, what would be expected?
If it were me, so Oregon OSHA doesn't have a rule, of course, about cloth face coverings. Again, we wouldn't look at them the same as a respirator. So the respiratory protection standard 1910-134 wouldn't apply in the sense of having mandatory training requirements. However, an employer is still going to be liable to a certain degree for the use of any type of equipment that is required for different job tasks. So what that means is the employer still needs to make sure that the cloth face covering that employees are wearing is maintained in a sanitary condition, and that the use of that face covering in and of itself doesn't create additional hazards to the user. But as far as an Oregon OSHA rule itself, again, we don't have a cloth face covering rule, but treating it as a respirator, the compliance officer who did a theoretical inspection of that workplace it would have to be evaluated on a case-by-case basis. And I'm happy to elaborate if there's additional questions related to this topic. It is, of course, a major point of concern for a lot of employers, so happy to elaborate.
Hey, Matt, can you just explain quickly what the purpose of the Appendix D is for those that may not know?
Absolutely. So Appendix D that we're referring to is found in the respiratory protection standard itself. Again, that's going to be 1910-134. And Appendix D is required to be provided to employees who use respiratory protection on a voluntary basis. So this means in situations where the employer does not require employees to use respiratory protection, or an Oregon OSHA standard such as asbestos or lead doesn't already require one.
I have a question about the N95 again. While I was doing research on this and trying to do a respiratory program, it says in there that if you're supplying N95s but you're not requiring them to use them, you still have to do a medical evaluation.
It will depend on the specifics of the mask type. Oregon OSHA, if someone is able to, while I'm speaking here, Oregon OSHA has a really great fact sheet that really lays out the different caveats in between voluntary use and required use. And one of the things on that fact sheet that I believe does a really good job of illustrating is there is going to be a requirement for providing an initial medical evaluation if the voluntary mask in question is not a disposable N95 mask. So essentially, if the employee is trying to use an elastomeric mask or a tight-fitting mask, even voluntarily, there is a requirement for those types of respirators for that employee to have an initial medical evaluation.
Okay, so but if it's
fill out the questionnaire.
So if it's a disposable one, you don't have to worry about the medical eval.
Correct.
And
Thank you.
Only if it's voluntary use. If the employer requires an employee to wear that filtering face piece, then they would need to have medical clearance to wear that.
Yeah, and then you'd have to do the fit test and everything too.
Yes.
Fit testing is only going to be required if the mask is required either by a standard or by the employer themselves. If it's voluntary use, there is not going to be that requirement to provide fit testing regardless of the mask type. And that's going to be listed on the fact sheet that I believe someone just posted into the chat bubble.
Okay, thank you so much.
Matt, if the governor is requiring that people wear a mask, not a respirator, but a mask, how does that play out into this voluntary use?
So again, OSHA wouldn't look at the face coverings as a respirator, and therefore the requirement for providing fit testing, training, and those types of things would not apply, because we wouldn't be able to use 1910-134, the respiratory protection standard, as a means of enforcing anything. So going back to what I said originally, what I would expect if I was still a compliance officer and I went into a place is that the employer who was allowing employees to use the face coverings, that they ensured that employees were essentially using them correctly, that the masks themselves weren't creating additional hazards to the employee user, or in some way creating an occupational health and safety concern, if that makes sense. But as far as citing out of our 1910-134 rules, those would not apply for face covers.
Right. That was my understanding. I just wanted to make sure we got that across clearly. Thank you.
I would like to make a clarification that Battelle decontamination system, my understanding is that it will be in Eugene, and organizations that want to use it will follow a system that they recommend to deliver the masks to that Eugene location of that decontamination system.
And I put the link to that in the chat system. If anybody wants more on that, I don't have a lot more. I can resend this link to you if you send me an email. Okay, well, I guess we can let everybody go. And I would like to thank everybody for all you're doing to keep yourselves and your loved ones and your employees safe during this, shall we say, unprecedented, trying times that we're going through. Thank you, and continue to keep up the good work.
Thank you, Mark.